Hello everyone. Let's try to simplify the key action statement for hyperbilirubinemia as published by the American Academy of Pediatrics in August 2022. So basically there are 25 key statements, and I just want you guys to know that although it looks like a big list, but honestly many are common sense and some are really easy to remember. So these are listed here. Let's go to next slide and I will tell you how to really simplify it. So the simplification is like this. Like for example, you always remember that we have to look for hemolysis. So that's common sense. And of course, remember when rheogram is given, mom could have, a baby could have this antibody, and we should not count that for hemolysis. Then of course, 3, 4, 5, and 6 all talks about the value of TSB rather than transcutaneous. And we know that is a standard, and the other one is just a screen. So again, it's common sense. Then rate of rise, as highlighted, is important. Then again, this is common sense that you should delay discharge if there is no follow-up. So no science needed here. And if mom is breastfeeding and bilirubin is keep on rising, of course we'll do the direct Bili. We just want to rule out cholestasis. So again, that's easy to remember. And we all know that whenever we start phototherapy, this should be intense, which is 30 microwatt per centimeter square per nanometer. And of course, we take into account the gestation, age, and or neurotoxicity factor. So that's again very easy, and there are graphs available. Then we have two other, and we talk about the home thing. Like if you're discharging a patient home and the baby needs phototherapy, always use LED. And the code is 3848, means the baby has to be greater than 38 weeks and greater than 48 hours. That makes sense. If baby is within 24 hours and more premature, of course, you don't want to do home therapy, then you admit, as says here. So home are 2 points. Then there are 4 or 5 key statements that are pertinent to phototherapy, which are listed here. So basically 10, 12, 14, 15, and 16, they talk about when to start phototherapy and when to stop phototherapy, basing on, of course, the criteria. So that's again easy. Then if phototherapy is working, or if the level is rising and it's only 2 milligram below exchange, of course we have to escalate. Escalate means you prepare the baby for exchange, and of course when you prepare, you start IV hydration, intensive phototherapy, call the blood bank, get the labs done. That's understandable. Then of course when you reach there and there is a hemolysis, you start IVIG and you can give Q12 hour. And then urgent exchange, we all know that if signs of encephalopathy develop or if the curves are showing exchange, you should do exchange. And then the other important concept is Delta Bilirubin, which I will post the link for that how you can monitor that. So basically it's a value phototherapy minus the actual, and basing on that, there's a very nice table given in this reference where you can really go what to do with the discharge planning, and of course educate the family. So in summary, if really we have to take home messages, there are a few points we have to remember. That transcutaneous is important as a screening in first 24 hours or 48 hours, but then TSB should be done, especially if the transcutaneous is within 3 milligram of or phototherapy. Then of course, if there is a hemolysis, you should check for other factors. Then phototherapy, when to start, when to stop, when to check Bili. You can check it Q6 hour to 12 hour. If there are risk factors, you can check 12 to 24, depending upon really what is going on. Then of course, the home plan and discharge plan, always whenever you do that, educate the family and escalate when needed, and exchange we talk about. So I think, although this looks like very cumbersome, but I think the authors have fantastically really done it in a very nice way. And always refer to that article, which is beautifully written with all the guidelines and graphs. So I hope this small presentation helps in understanding the key action statement for hyperbilirubinemia, and you guys have a wonderful day. Bye.